Hello everybody, welcome to my YouTube channel Homeopathic Super Sessions by Dr. Jagos. Today, on the request of many of my viewers, I am going to show you a good important remedy, or rather tell you an important remedy about Tuberculinum bovinum. I repeat, the remedy Tuberculinum bovinum. In my experience of last 35 years of practice, I have used this remedy with good results. It is a commonly used remedy, but it is not so used frequently. Or rather, you can say it's a common remedy, uncommonly used. So the main indication for Tuberculinum bovinum is the ailments from, or the causative factor. Ailments from have never been well since the last disease. So this the patient will tell you, or the mother will tell you if the child is coming to your clinic, saying that, doctor, after my child has pneumonia, he is not keeping well. He is getting recurrent cold and cough. Or doctor, after typhoid, after dengue, my child is not keeping well. He gets recurrent some or the other infection. So this is very important causative factor, ailments from not being well since the last disease. So it can be not being well since a head injury, not been well since a urinary tract infection, or not been well since typhoid, since dengue, since malaria, or whatever the cause may be. Along with that, another important symptom is changeability. So the changeability will be there, saying that sometimes after typhoid fever, the patient still gets little bit of, or rather after being cured for typhoid, after typhoid fever completely goes away, the patient still feels feverish. Sometimes the fever comes in the morning, sometimes comes in the evening. There is no fixed time. So changeability is another important aspect of the drug Tuberculinum bovinum. And also, you have to use this drug in the 1 mg potency. Initially, always give a wet dose. Dr. Hahnemann has always said, give a wet dose in little bit of water. You dissolve 4 globules, or you dissolve 2 drops of the liquid, stir it, dissolve the pellets, and then take it at bedtime. So 1 mg, 1 dose can be given initially for 3 consecutive days, repeated every week. That means, for example, every Monday night, Tuesday night, Wednesday night you give it. Again repeat next Tuesday, next Monday, Tuesday, Wednesday night, and so on and so forth. So this is a very important aspect of Tuberculinum, which I think some practitioners or many people do not know about it, and they don't use it in their practice. So I have used this in cases also where you do not get enough symptoms at times. You see, they will just tell you that ever since the last disease, I am not been feeling well, and I'm getting some, and my immunity is less, and I'm getting some or the other problem. So kindly help me out. So in such instances, you can definitely think of the drug Tuberculinum bovinum. Or in spite of giving the constitutional remedy, there is recurrence again and again. So you have to interpose a drug of Tuberculinum 1 mg, 3 doses at bedtime, along with the constitutional medicine. This will open up the case, or the recurrent tendency will be mitigated. Please use it in your practice, and please give your comments, if any. I'll be glad to see it and also reply to it. Thank you very much.